Triple negative breast cancer mainly affects women under the age of 40 and mainly women who are African American or Latina descent. It was hard for me because I'm an Indian woman and there are disparities in our healthcare system that some medical teams don't take into consideration. The reason why I'm so vocal about my cancer journey is because I wanted other Indian women or women of color to see someone who looks like them and who knows how they feel. And I wanted to be honest about what I'm going through because I didn't want cancer to be so stigmatized. Like, yes, it does suck and it's a horrible disease, but just because I got diagnosed with cancer doesn't mean like I'm a bad person or I brought this on myself.
In most cases, the lump of cancer can be discovered during the first or second month of growth. But don't forget, your doctor usually doesn't see you that frequently. So the next time you visit your doctor for a general physical checkup, be sure to ask him about breast self-examination.
I've heard women of color talk about the pictures that they show you aren't women of color, they're showing you white women. And especially in the breast cancer community, seeking support, it's mostly for white women. It's very like kind of culty and like, positive and do yoga and whatever. And I'm not that type of person. And I think the healthcare system can engage with people of color or people at a disadvantage with healthcare, I guess, in a way that makes it more accessible and more welcoming. For example, I think the medical community can benefit from patient advocates. Someone who's already been through the treatment or diagnosis to, be in that room with that patient so that patient feels like they have someone there on their side and not feel so alone. I guess I would give my example. So on my first day of chemo, I met my social worker and she was very kind. And, she's the one who told me about the Road to Bald program for my hair. And it was just like she saw me, she saw me as a patient. She saw me as a human being. And if I ever said something like, she would be like, okay, let me go talk to your doctors about it or tell like the nurse practitioner about that you're feeling this way or whatever. And it just felt nice to have someone else vocalize that to my team.